Now it's time to answer some common health questions. Joining me is News Channel 5's medical expert, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Always great when we have you here.
Good to see
we
you.
have some these questions kind of run the gamut, okay? So just general health questions. Now, a lot of people we know over the years, we hear about heels being not so good on your feet. What about flip-flops? Do they affect your knees at all?
Yeah, well, flip-flops are pretty common down here. And the reality is that in the short run, it's no big deal. It's not going to bother you too much. But in the long run, some experts would tell you that it's probably the most dangerous shoe you can wear. They have no arch support, and it actually alters the way you walk. So it can cause anything from any pain, actually, from the back all the way down to your toes. You have to think about your shoes. And anytime you have that, you got to think arch support, and you have to think about the way your shoes fit and the way they're making you walk. So because of the lack of arch support, because of the way they change your gait, it can cause anything from plantar fasciitis, which is inflammation in the bottom of your foot, to your ankles, knees, hips, and even lower back. So if you have to wear flip-flops, make sure that you buy the kind with arch support. Make sure that you try not to wear them all day long, shorter periods of time, and certainly don't wear them every day. Maybe alternate. And then you'll avoid the problem in the long run. So think about that.
Okay. Also, a lot of people have been talking about croup. I know that's something I got as a kid. You can hear that cough from a mile away.
Oh, yeah.
Any way to treat that maybe people don't know about?
Yeah, well, croup is caused by a virus, and what it does is it causes inflammation, infection of the larynx, and it causes narrowing of the larynx, and especially in children, that larynx is very narrow, and that's what causes that characteristic barky cough. Now, like any virus, there's no cure for it, but there are some things that you can do that'll help alleviate the symptoms. And the good news is that croup is relatively short-lived. Typically, in a day or two, the inflammation starts to resolve and your child is nowhere near as sick. But in the meantime, you could try some cool mist aerosols at home. Anything cool, sometimes warm works too, but anything cool helps kind of shrink some of that swelling. You want to look for difficulty breathing, or what we call retractions. If you see that, you need to bring them to us in the emergency department. We can use steroids, whether it be injectable, oral, or inhaled. And then, of course, also some epinephrine aerosols work real well. And believe it or not, a couple months, 'tis the season. So we're going to be seeing a lot more of it, so just be aware.
All right, great, thank you very much. Instead of going online and looking for yourself, you can actually ask Dr. Soria a question yourself. Go to our website, WPTV.com, click on the health link, and you can fill out a form and ask him any questions that you may have. Thank you for coming. Always good to have you here. I'm sure